Okay. I'm Michelle Hudson, for those of you who don't know me, and I'm running the meeting in Nicole's absence because I work with the NCI now. I'm a new data scientist slash engineer working on the Connect for Cancer project, and I've been here about a month and a week. So I've been having a good time, and I've been helping out on the CDM notes and transcription and getting the recordings together. So that is me. Is there anybody else who is new who would like to introduce themselves or reintroduce themselves? No, you've all been here. Okay. Then we can move on to the next agenda item. So Nicole sent out the agenda, and the main announcement is that we're moving this meeting to 10 o'clock in the morning Eastern time. So the next meeting, Tuesday, September 2nd, will be at 10 a.m., and then we'll have it at 10 a.m. going forward. And if you have any objections or conflicts, just let Nicole know. And otherwise, look forward to 10 a.m. Eastern next time and from now on. Okay, Stephanie, the next agenda item is that you have an update.
Okay, so let's see. Let me share my screen.
Great.
Oh, that's not it. Can y'all see my screen?
I can see it.
Okay, so just quickly, just for Michelle's information. So last time we met, we went over all of the data elements that we're mapping from the survey instruments that AI Ready is collecting. It's basically type 2 diabetes data that we're preparing for AI purposes so that it's more diverse and more, I guess the word that we're using is better, not necessarily diverse, but to be ready for AI modules to take into account for analyzing various different type 2 diabetes data. So through the survey instruments, we were able to map obvious concepts, things like marital status and many of the lab measurements like troponin T values. OMAP vocabulary tables already has these concepts, so it was just a matter of matching up the data elements to very specific concepts that are in the OMAP vocabulary table. And then there were concepts that it did not exist in the OMAP vocabulary table. For those concepts, we created new concepts to capture these questions that were being asked, things like worrying about the future and the possibility of serious complications, or how often have you been treated unfairly by teachers or professors because of your race and ethnicity group. So those concepts weren't present, so we ended up minting new one. And then there were questions that are complex in nature because the first part of the questions were same, but then the answer portion varied by different types of disease and condition. So way we captured these type of complex questions where both the answer part and the question part has to be combined into a concept, what we ended up doing was mint a new concept for this question part. And then for these various different conditions, we ended up using a qualifier concept to capture each of the condition where they answered yes to. And then in that way, this generic questions can be captured using one concept ID. And then if they answered yes to these conditions, then what we also did was dual map not only map the fact that this question was asked and the answer was provided, but if they say yes, being positive to a condition, we also map the concept in the condition domain for whatever condition they're answering to. So we captured the question part of it in the observation domain because survey conduct wasn't available in the version of the OMAP uh, 5.3.1 that we're using uh, OMAP CDM. And for the condition where they answered positively, we also map it to a condition for that condition that they answered, whether it's Mario um, MI or type 2 diabetes or any stroke or whatever condition it is. We put that condition in the condition domain um, to capture the positive response with the providence of that condition being, self-reported by the patient. So they could distinguish the difference between actual diagnosis by a physician versus self-reported condition. And the structure we used to manage all these mapping is this as follows. Each of the source code column contains each of the data element that were used in the survey form. So we know exactly which question it is. And then the description of the actual text used in the question, we put it in the source code description. And then for each of the mapping that we provided, we put it in the target concept ID. And we also use extra information of, whether it's exact match or broad match or narrow match type of thing, and how confident we were with that mapping if we're using the existing concept ID. And the qualifier concept, again, is the portion where we needed to specify types of condition that are associated with each of the questions that were being asked in the survey
So
question.
these are all columns in the same table?
These are all the columns in the mapping table that we use.
Yeah, okay.
So the ETL person could take this and whatever concept ID that were in the target concept ID, what they put it in the domain, OMAP domain concept. So this is the structure of the mapping table. And so this is what we review with Alex, and whether we wanted to socialize this, how we map these complex questions where you had to not only capture the fact that question was answered, whether it was negative or positive, and if the condition was positive. In OMAP, we don't really put negative response anywhere, but only positive responses or condition that they already have. So this is the dual mapping part where if they answer positively to a condition, then we also map that condition as a self-reported condition in the condition domain. So that's what we reviewed, and Alex thought that maybe we could socialize how we did capture these concept for others who had to do the similar thing, maybe could do the same thing in terms of different types of data that we mapped were the survey questions, and then there's the Montreal Cognitive Assessment Test, which is a very well vetted, I guess, a survey instrument that people often use to measure a person's cognitive abilities after brain injury and such. So I think the psychology group is also doing the similar thing. And so if we could maybe put our brains together and then come up with a same way to capture this data, then perhaps OMA vocabulary table team working group may be more willing to adapt the MOCA concepts and roll it into the official standard concept. There are another one that was like 179 data elements that we also captured, or eye care and vision associated with data elements, where we had to capture various different visual acuity measurements and what type of machines were used to get those measurements. And they were getting more and more popular among the researchers who are interested in capturing the vision data and how various different drugs are responding for those conditions. So perhaps we could also roll those concepts into a standard concept, but then we have to socialize all the concept that we mapped and then see how many of them could be rolled into standard. So we plan to propose all the concept that we minted for AI Ready group into the submitted to the vocabulary working group and see where we could go from there.
In the chat, I pasted the link to the Google Doc that Nicole shared. She forwarded to this meeting, which has the mapping. And then I don't know if you want to go over that and how you ask for feedback, or if you want to explain this, or if there are questions about the other part of the presentation.
So as I mentioned before, the source code column identifies the exact field where all these questions concept were used. And you could see here the target concept ID for this beginning part of the question. We just use the same concept. And then for various different conditions, we use the modifier column, actually the qualifying concept ID column, to specify these various different conditions. And if you thought that that was a good idea, or whether a combination of both the question and answer part should be rolled into a one and given a specific concept that are unique, but not use the same one, breaking apart between the beginning part of the question and the answer portion in the qualifier concept, that would be a good comment that we could use. And these are basically various different questions that were being asked in the survey question that we didn't have a specific concept we could use from the existing OMA vocabulary table. And some of these you could see are answer concepts. How often, or rarely, or none. These are also question answers that were used in the because as you can see, there are different fields where the same type of answer response are being used. So this is how we capture both the question and answer portion of the survey instruments for the ones that we couldn't find from the existing OMA vocabulary table. So if you could give it a quick glance, I think there are about 436 terms. Any comments you may have, that would be helpful.
And there's a column in the Google Docs for review. If you've got comments, you just want to put them in there. Or are there other ways you would like to receive feedback?
Yeah, I think we put it in at the end, reviewer's comment. So any comments you may have, like any thoughts, questions, or I think it would be better if you did this or that. So any response you may give to us from in the column AE, then we'll take that into account and review each one. So if you're able to provide this feedback this month, that would be great.
So, Stephanie, where are these forms from?
These are survey instruments that were created and asked to the AI ready participants. There were about 4,000 participants who were I think they came to the site, UAB, UCSD, and UW, or University of Washington, where they requested these participants to respond to these questions, and they captured all these data through a RedCap survey, and
Okay.
we took those responses and created a mapping table to map into OMOP CDM.
And so are you involved in the MATLink project at all?
MATLink, I was in the beginning, but we kind of,
Yeah.
yeah,
Because I'm pretty sure they're going to have to go through a similar exercise, right?
yes.
Yeah.
And
I had
there's no,
a question.
a lot of a lot of survey questions, you have to manually curate them because you have to look at the question itself, how they were presented to the participants and how they are capturing the responses. So it's not very, it's hard to automate. So you have
Yeah.
to manually curate them one by one.
And what's the AI ready part of it? How is AI involved here? Because you said it's hard to automate this. I was wondering if you could use AI to make a first pass and
Right.
then,
So a lot of EHR data that we have can be utilized, but this particular data set was prepared with the thought in mind that the data that we collect shouldn't be just for one large race group or ethnicity, but that it should be diverse data with diverse race, diverse socioeconomic, scale of participants with all type of diverseness. Um, so that's what or making it better for these AI models when they utilize it in health research, that it's not skewed to one area or one population, but that it's better for these models.
yeah.
So
Hey,
that's where the word AI ready, I think. It's funded by the NIH Bridge to AI Common Fund program, and it's just creating a foundation of data that could be better prepared for the AI research.
Monse, you have a question?
yes, it was actually related to the question that was just asked by John, which is the possibility of automating. So all of this mapping, you've done it basically by hand, or
Yes, we manually
yeah.
curated them.
Okay, because I was wondering how, and I don't know you're familiar with epiharmony, which is what Jaya at NCI is developing. I think he's presented in this group before, and he's using large language models to aid mapping of variables and harmonization. So I was wondering if there had been any crosstalk between this.
We have not, but I
Yeah.
think largely, even if you automate them and you map them, you still have to review it, right?
Yes, of course,
To
but it could
yeah.
save a lot of work.
Yes.
So we are testing that now, and that was one of the things that I think we discussed in this group. So I don't know, maybe that would be good for you to get in touch with Jaya, who has presented before. It might be good to see
Okay.
if that's something that could be aided.
If there's
So
a contact person I could reach out to, maybe you could.
Yeah, Michelle, do you know who I'm talking about?
Yeah, I know Jaya. What was
Yeah.
the name of the project?
Epiharmony.
Epiharmony. Okay.
So maybe you can put in touch with Stephanie. I think it might be good. Thank you.
So in another project we started looking at various different keywords that you extract out of the each questions, and then see how that could that we could find a concept for the existing version of the vocabulary group tables in OMOP. But for the ones that we couldn't really come up with, we had to just mint a new one. So that was the two parts that if the concept does exist, searching for it was quite simple, but determining whether this concept exists or not was the complex part. And then the survey, some of the survey questions were not a simple concept, but it was a combination of both the answer portion and the question portion has to be merged to look for a concept. And those were tricky. Yeah. So the MoCA specific ones, I think we tallied the sum. There were 37 MoCA terms that we mapped, and then the vision related ones are 179. There were 38 that were lab related, which we were able to find. We didn't have to mint any new ones there. There were custom concept, as you saw it here. There were about 300 436, but some of them are same concept. So I think they're unique, but 344 new ones.
So when you say 47 survey instruments, is that a combination of sort of these industry standard assessments like MoCA, PHQ-9, validated instruments, as well
Yes,
as some study specific questionnaires?
Yes.
Gotcha. Okay.
So
And
combination of both. So combination of both. The MoCA surveys were obviously well vetted form that everyone uses. But some of the questions were created using REDCap that are specifically designed to capture AI-ready data.
Gotcha. So of your 47 survey instruments, how many of those were like MoCA in that they were industry standard?
I don't have that distinct counts out of the 47, but based on what we saw, the good amount of the concepts were already, there were like, so if you were to look at the total elements mapped out of this, we only had to create 344 custom codes. So most of the terms we mapped using the concept that already existed in the OMOP vocabulary table.
Yeah, it would be interesting to see the breakdown in terms of, so here's how many survey instruments we had, here's how many questions, here's how many answer lists. And then it sounds like beyond creating codes for the actual components of the questionnaire or survey, you're also mapping to sort of the meaning, right? So there's the verbatim text, but then there's the meaning once the question has been answered.
So we had to make sure, so in OMOP CDM, if the condition doesn't exist for a given patient, the data doesn't go in, right? If you have a positive condition or you had suffered some, taking medication for various different conditions, then the data goes in. But if you say don't have diabetes, your data won't go in there. But in this survey questions, they wanted to make sure the participants answer the question regardless whether they have the condition or not. So if they ask, do you have, have you ever been informed by the healthcare professional that you have type 2 diabetes? And if they say no, they still wanted us to capture that data. So since we were using OMAP CDM version 5.3.1, there wasn't a survey conduct domain to capture those questionnaires. So what we did was we put it in the observation domain with the response of that question as no, but still put the fact that that question was asked and the participant answered.
Mm-hmm.
And then if they said yes to a certain condition, then we look for that condition concept in the OMA vocabulary table and put that data in the condition domain.
Yeah.
So,
Yeah. Yep.
right.
Okay.
So we dual
That makes
mapped,
sense.
not only capturing the fact that they answered the survey questions, but if the condition exists for whoever answered for that participant, then we put that condition in the condition domain with the provenance, with the fact that it wasn't, physician diagnosed condition, but it was a self-reported condition.
Interesting.
So you could tell the difference
Yeah.
between, whether it came from EHR data or claims data or, self-reported survey data. So we put the metadata associated with the condition so that the researchers could filter that if that's important for them. So
Where is that metadata field?
the domain type concept ID.
Okay.
So in OMAP CDM, you could specify the type to indicate this came from EHR data, or this came from claims data, or this came from, self-reported data, survey data.
And those fields exist in observation and measurement and all of those good tables?
Yes.
Yeah,
So,
okay. And it's coded. There's a code for each of those.
Yes.
Excellent.
Is there a distinction for the type concept ID? Is there a distinction between patient reported and reported via a survey or assessment questionnaire?
So if the survey form was presented to the participant and they answered yes, right? That's a different than you went for a blood test and your, A1C level was above 6.5 or 9.5, then there's very distinct different
Yeah, no,
data.
absolutely.
Yeah. So
Yeah.
OMAP
So-
uses this condition type concept ID field in the condition to indicate the provenance of the data. So you could say this came from case report, this came from claims, this came from EHR. So there's
Yeah. So my
different
question,
provenance.
yeah. So I understand that piece. So my question is, do we have distinct concept IDs for, so there's patient reported, right? That you just, you have an appointment with the patient and they tell you something, right? That's one way. But then there's also this more specific kind of patient reported, which is we obtained this information specifically via a
EHR
questionnaire.
admissions notes.
Yeah. Do you see what I'm saying? Like patient reported versus patient reported via questionnaire.
Oh, I see.
And
So if you think it's important to note that distinction, self-reported through a survey instrument, we could mint a new type concept to indicate that details. If you think that's more important to know,
I'm
then
not sure
so
if it is or not.
we used
there
what
is.
was available. Yeah. We use what was available in the concept, but it doesn't distinguish the difference, I think. Let's see.
You see the comment in the chat? Sounds like there is a concept for patient-reported survey. Patient, no, I'm not seeing it. Who posted that? That's Lowe's?
Oh, patient-reported survey.
Okay.
Patient field
self-report.
survey.
Hmm.
Patient self-report. Patient
Mhm.
field survey. Maybe we should
Okay.
use this. Yeah.
Yeah, so one other use case. So I've been working on this with the psychiatry working group. And I wonder too, sometimes it's not the patient that's completing the questionnaire, it's a spouse or a parent or a caregiver. So I wonder, we call that in the mental health world, we call that an informant. So it's informant reported. Maybe that's something to consider. We don't need to go down this rabbit hole right now. You just got me thinking.
Oh, okay. So we could just make a note that it's important to know whether it was patient field survey versus informant reported for the participant.
Yeah.
And if it's not important for the research, they could combine both of those provenance to collect the data. But if it is important, then they could filter based on the type to only use the data that came from the patient. Yeah.
Yeah, I think the distinction between how it's obtained, that it's obtained using some kind of a survey instrument, it is important. I also think, well, I'll let you keep going. I have a couple of questions. I just don't know if they're appropriate for today's conversation or not.
So distinction of the origin of the data, whether it came from the participant or the informant is important. But what was the other one?
So, so then two other kind of clarifying questions I have, and please stop me if this isn't the time or the call for this conversation, but there's one thing that I haven't seen sort of acknowledged in a lot of the work. I know a lot of folks are doing work around these assessments, and I think it's really important though to make a distinction between sort of two major classes of assessments or surveys. One class are the psychometric instruments, right? So those are assessment instruments that have been validated to actually measure some construct or some phenomena, right? They have predictive validity, they've been developed using, rigorous mathematical psychometric methods. So that's one class. And then so the MOCA falls into that category. And then the other class, actually maybe there's three. The other class are sort of these instruments that are widely used, they're industry standard, but they're not designed to predict or measure anything, right? It's really just a way to make sure that we get a standard set of questions answered. And there are instruments like a lot of the new food insecurity, transportation insecurities, kind of gravity type assessments, I think fall into that category, right? They're not developed using measurement science, psychometric methods. And then I guess the third class is kind of what you're talking about here, which are these instruments that they're not widely used, right, in healthcare, but they're used in really large studies. And so we want to be able to sort of capture that data. We want to capture the semantics of that. And when I think about those types of assessments,
Hmm.
I'm thinking about NIH Toolbox. I'm sure, are you familiar with that, or folks on the call familiar with the NIH Toolbox?
Not
No,
really.
I'm not. No.
Okay, so it's really sort of a pool of questions, right? So I, I, I almost feel like when it comes to these sort of study specific surveys or questionnaires, we sort of want to, we kind of want to adopt a model like that, where what we essentially have is a pool of questions, right? And some of those questions might actually be reused in multiple studies. And so, that kind of provides a way for, say, we've got two really big cancer studies, right? And they're both looking at questions about, has the doctor ever told you you have XYZ? We'd already have it in OMOP, right? We've already got that in our, not our NIH toolbox, but maybe it's in our OMOP toolbox, right? It's basically, a pool of questions and a pool of answers. I don't know,
Harper,
just kind of thinking out loud here.
Yeah, so
Harper,
oh, go ahead.
I'm saying that X, Y, Z are just like the different values of the same variable, or a couple of variables that could be assigned to the same question.
Do you mean like the meaning, right? So the question is, has a doctor ever told you you have heart disease? Yes or no? And so there's the question itself, right? There's a concept for the question itself. There's a concept for each of the answers, but then depending on what they answer, if they say yes, there's that clinical finding concept, right? Or condition occurrence concept. Is that what you're saying?
Yeah, but that is the simple model, right? But what is an addition in this specific project is that you got the triplets, right? So you got another dimension of things, which is in this case the condition recorded as a separate variable, and then you have the triplet, right, instead of the question and the answer. I thought that
Go ahead.
Yeah, the triplet. So you have the question, then you have this condition as an addition, right? So it's
Yep.
not part of the question. There is another dimension, and
Yep.
then you get the answer or whatever frequency or whatever else in the answer, right? So you have basically a triplet, and I thought that you've been talking about pretty much the same model, but probably I misunderstood.
No. And the triplet could be not just the condition, right? The triplet could be something like a intervention, right? Or drug exposure. Have you ever been exposed to, well, I guess that would be a condition. Have you ever had open heart surgery?
Right, so it's a
Right.
data model feature, not
Mm-hmm.
has
Mm-hmm.
nothing to do with the content.
Mm-hmm.
So the procedure that you receive, the procedure could also be dual map, not as a condition, but in the procedure domain that you receive such,
Yeah.
procedure at such date. Yeah.
Yeah, like an
But
observation, right?
right,
Like
right,
a situation with history of open heart surgery or something.
right. But it's
Yeah.
important to capture for those type of survey when they design it, when did you have it? Was it a
Mm-hmm.
year ago? Was it,
Mm-hmm.
5 years ago, or was it last
Mm-hmm.
month? It's important to have a specific date, because we can't put data in the OMAP domain without the date oftentimes. So it's important to have those date captured at the time when those survey instruments are designed.
Mm-hmm.
But so some of the MoCA terms here, the cube drawing score, the clock drawing score, the animal name recall task, these are commonly asked questions in the MoCA instruments. So we thought that we could just submit this to the OMAP vocabulary working group, and then perhaps they could, put an initial version of standard concept for MoCA terms, and then maybe vocabulary ID could be MoCA. But we thought that it'd be best to have it adopted initially, even if it's not 100% correct. So over time, we could make it more perfect with the iterative approach.
Right. So I think this specific project is like really great, and specifically in terms of that you actually had to deal with the triplets, right? So there has been a lot of projects like that. So we've put in place the UK Biobank, ERTC quality of life, and all the rest questionnaires. But I think this one is really unique in the sense that you have these triplets, right? And it's really great that you found this elegant way of dealing with them, right? And even though it's not like whatever the standard or approved, ratified approach of doing this, but at least you solve this problem in your specific setup in the project, right? So it's already great. And like the outcomes of the project, I think like two different outcomes, right? Or possible outcomes. One is the vocabulary, and then you could have two different pathways. One is you bring on your source concept, and you might want to have that if you're doing this whatever network or study in the network setup, right? So if you have a lot of users and they are across organizations or in different places, then you might want to have the real concepts instead of the fake 2 billionaires, right? And the content that you produce, the standard content, and specifically for those cases when you have these, whatever, as we call them, industry standard assessments or whatever you can call them, but at least if there is a group of people that agree that that would be a proper standard for them, right? And in this case, the group is actually OMOP users, right? So if you come to the working groups and they say that, yeah, we're going to use it for whatever different studies, then it's a green light and we can bring this content at the standard concepts to the OMOP vocabulary. And another outcome of the project that would be beneficial for everybody, right, is to learn from how you actually dealt with the triplets, because we've never done this before. I think maybe other users done it before, but I haven't heard about it previously. So I think that will really beneficial if we sit together and think how this approach could be beneficial for other projects, right? Because in different survey instruments, you always struggle with different problems. So somebody have triplets, some other people, they have some different, whatever, derivative terms or any sort of different data model problems. So maybe that would be a step forward to solve some of these problems. So that is why maybe we can still spend some time on talking the vocabulary tone, because I think that like this problem and the different problems like that of how do we map things, how do we capture things, how do we store things, and do we even map at all, right? So Piper was pretty much surprised that we do map to facts, I mean, in the specific project, but I think that was most of the mapping done, because you can't really map triplets because there is no standard terms that would support this sort of questions, right? So I think that is like the only, well, you can also map to the conditions themselves, right? And to the frequencies and all those sort of things. But that is like a given, right? What it's really the question is whether you're going to map to the questions or whether you're going to map to the different ways of asking the same question, which is not actually the same. So that is like where the complexity starts. Michelle, do we have this
So
agenda item? I mean, the
We do. So let's finish up with Stephanie. John, you've had your hand up forever. Do you have a separate question other than this? So I will write down all this stuff about the validated surveys versus common surveys versus surveys that are created, because I think that's important for us to know too, especially since we're doing the landscape survey. Again, we want to get like what surveys have you mapped and what kinds of instruments and surveys did you use? So John?
I do have a question. Just wanted to say, Stephanie, this is amazing work. You've done a great job here. Very impressive. And it's durable work, or at least it should be durable work. And I was wondering, that mapping table that you created, I feel like should be part of CDM if it isn't already. And I feel like the mappings that you've created, that they're like it looks like you're sharing it through Google Docs, and you had a GitHub repository open, but I feel like it's something that should, they're almost like Athena, that there should be a way for these mappings to be very well advertised and published and known, so that we do start to have a collection of instruments that are shared and used and well understood, and you're well on the way to making how survey data is modeled in CDM turnkey. I mean, you're almost all the way there, if not all the way there. I can see people plugging into this, and it being hugely useful to the community at large. How, so I guess I'm asking, how far along that road are you, and where are you headed with that, with making this durable and commonplace?
So we're waiting for all the responses. So as I mentioned before, these terms are grouped in three buckets, largely in the general survey data, and then there's MoCA terms that it's commonly used in Montreal Cognitive Assessment Test, and then there's vision related that are becoming more and more important for people who are doing vision and eye care research. So they're in those three groups, and we essentially merge our concept table with these specially, minted custom codes and the concept relationship, and we use it in our ETL. We are essentially just waiting to submit these terms to OMA Vocabulary Working Group.
Yeah.
But we haven't yet submitted yet, but we wanted to attract as much as review from everyone on the field, and especially this survey working group. And any comments, any advice we want to collect and make sure we want to be comprehensive and socialize this idea that these are what we did and these were the custom concept we created. Would you please consider adapting it to part of the OMAP? Maybe call it the AI ready, or maybe call it MoCA. I don't know, but
yeah, I was thinking more specifically about that mapping table that you had showed with the source instrument or form, and then the question, and then it maps to the concept. Yeah, that one. Is that going to be part of CDM, or what's the future of this? And what's the future of the data that you've already populated with for the instruments that you've looked at? Because that seems eminently shareable and reusable.
We could certainly share this GitHub in terms of what they would want us to put it on the OMAP Odyssey GitHub, so that others who are interested in capturing survey data could utilize the same list. That is up to the Odyssey group to let us know, hey, could you start creating a survey section and then check in these both questions and answers, and how we use the mapping table to ETL into the OMAP CDM. We would certainly be happy to check them all in under the Odyssey GitHub umbrella, so others who may be interested in using it and leveraging it to their needs, that we could certainly do that.
Yeah, from my perspective, I would think that would be hugely helpful. It would be hugely helpful to me, And one of the other things that I'm very interested in is social determinants of health. I don't think you mentioned that as one of the areas that you were looking at, but there's lots of standardized instruments around that would be very useful to create this type of mapping for, that could be very reusable.
Mhm.
Yeah, so I think also some of this discussion today was because Alexander and Nicole and many of us said, like, how do we socialize this mapping source and target table? So that's why
Yeah.
there's the Google Doc. So definitely go fill that in for whatever you think about reviewing each term. And we shared that and it's in the notes as well. So I think part of this is how do we get this out there so that people can use this work that's already been done.
Yeah, great work. Yeah, great work all around. I didn't mean to give all of the credit to Stephanie. So for everybody that's been working on this, this is going to be a great asset.
Cameron,
Thank
did you
you.
have a question as well before we move on to vocabulary-thon reminders?
Thanks. Yeah, I love this as well, and I was mostly just reiterating, I think, the consensus of the idea of preserving the source of the information in a very easily accessible format for researchers, because particularly when you started talking about a question that asked about a procedure, right now procedure codes are probably the most reliable codes because sort of some of the concept IDs for like diseases are they're not always reliable in the EHRs, but the procedures are much more likely to be real because you're unlikely to like have in your record that you had a whatever heart surgery if you didn't have heart surgery, but you might have in your record that you have heart disease if you didn't have heart disease. So it started to just crystallize for me how important it is that if we get this as self-report from a participant, that it be very obvious to researchers that it is coming from that source rather than from sort of a health organization, health provider organization, EHR, because it's going to have a huge impact on the quality of the data and the reliability of the data, and researchers are going to need to have that information. So I think it's very elegant. I love this work. Mostly just reiterating those other points that people have already made.
Great. So Stephanie, can you share the link to that presentation that you were going through in the chat or email it to me and Nicole?
Okay, I
However
will.
you, yeah, great. Then
Yeah,
I can send it out and people can review it.
yeah. This
And
was
thank you so
presented.
much. Yeah.
Yeah, this was presented during the leadership meeting, Bridge to AI leadership meeting um, last December. But so I could either send you this link, or if you want me to revise a little bit and add more other contents that may be important, I could do that as well.
Yeah, that would be great if you want to revise it for
Okay.
this group, especially since everybody's interested in continuing the conversation. It might be good to have it updated with what we've talked about.
Okay.
Great, perfect. And then we have 4 minutes left in the meeting. Alexander, did you want to discuss the vocabulary-thon and plans for that, since that is coming up?
Yeah, and especially because I have an update on this topic,
Great.
right? So I haven't had a chance to talk to Nicole, but probably you'll be able to reach her out, right?
Mhm.
So the thing is that we already have the officially confirmed date for the vocabulary event at the Global Symposium. So let me share my screen so that you can. There is a whole schedule of the events on the Global Symposium, and on the first day, which is October 7th, Thursday, there is an open slot that is currently called collaboration activities, right? We will get the slot to run the vocabulary-a-thon during the first day of the symposium. So everybody is invited from 8 to 12. That would be the event at place. And well, I haven't had a chance to talk to Nicole, right? So probably she will be able to join, and all the rest of the members who come to the symposium will be able to join, but we just need to double check this.
So that's 8 to 12 on October 17th?
Yeah.
Great. And it's called collaboration activities on the schedule.
It's like October 7th.
7th. Okay.
Yeah.
It would be good if I could read. Okay, great.
So
Is that
we will be adding this official information to the symposium registration, to the official symposium page. Well, it will take some time, but that is sort of sneak peek.
Great.
Michelle, are you gonna come?
I am not coming, but Nicole will be there.
Let's see. Okay, we'll need to double check with her and then with the rest of the group whether we're gonna do that at this specific time slot. Hopefully, yes.
Okay, so then the last thing I have is just a call for everybody to fill in the landscape assessment survey version 2, and I can actually show you what we've done with the first version of the landscape survey that you also kindly filled out. That way it's not just like in the ether. Can you see this? I know it's small. But I'm pulling the information from the survey to do this mapping. So based on the studies that were reported last time, these are all the studies that we got information on. These are the websites for the study. Here is something that we were talking about today, actually. What kinds of surveys did you map? Were they created specifically? Were they repurposed from existing literature? There was one for like, was this a validated instrument? But nobody chose that. Nobody used validated instruments. Or maybe they did, but they didn't reflect it in the survey question. Whether the survey was mapped to OMOP and the contact person for these. And then so surveys by study, this could be helpful in that too. For the kind of information we're talking about. Like for the breast cancer now generation study, they have one survey, the questionnaire, but they have 5 follow-ups. For the All of Us research program, there are links to the Survey Explorer, which list like their basic survey, their lifestyle survey. So these are the surveys that are being mapped. For AI Ready, there's a link to their docs. So if you want to know more about the AI Ready questionnaires, like I know we had some questions about that, like where did this information come from? Here are links to the surveys themselves and the information you can get about them. So we'd like to have this for more. So if you've done more studies and you have more surveys, feel free to fill out that Google Doc link with as much information as you have. Like you can even just say, since I'll be pulling them in this way, just like what surveys did you map? Please give me a link to them or a link to your mapping. Or like for AI Ready, we also have the link to Stephanie's poster on data standardization, like anything that might help us understand how you mapped it or what you mapped. And then we'll know a lot more about what's been done.
And are you looking only for surveys that have been used in research, or are you looking for sort of lists of surveys or assessments that are captured in the EHR period?
So I think we're
Go
looking
ahead.
for anything that you've mapped. So this is a mapping survey. So if you've mapped
Okay.
questions or a survey to something, whether it was for an actual project you did or because you needed these things mapped for some other reason. So I think anything that's got mapping to OMOP or being planned to map to OMOP, we want to know about it.
Okay. And so how do you want us to provide that to you?
Did you see the link to the Google form?
Let's see. Oh, is that the red cap survey?
No.
Or no, the Google form. Sorry. Nope, not seen it.
Okay, I'll send it again.
Okay.
It's
Sorry.
in the chat.
All right, let's see.
And Teams is kind of not opening it for me. But if you have to drop, thank you so much for coming. This recording will be up later so that you can review it and I'll send out meeting notes.
Thank you.
Thanks so much.
Bye.